You're asked to treat is the smoker's face. This is well reminded to us by Humphrey Bogart from Casablanca. Those of you who are old enough to remember him as one who always had a cigarette. And here, cosmeticals was important to help his smoker's face and prevent damage from smoke. But at the same time, the antioxidants might have decreased his free radicals, his oxidative stress that led to cancer of the lung. So here we have the evidence that we can help cosmetically, and again, vice versa, the therapeutic aspects of antioxidants. The next slide, please. And in this realm, we get oxidative stress from cigarette in two fashions. The smoker, as you know, inhales, and with each puff of the cigarette, he or she inhale 10 to the 15th power of free radicals, plus extra free radicals that are made by the 300-400 plus carcinogens or other chemicals that are inhaled, even in the gas phase smoke. Because remember, the filters only remove tar phase, about 99% of it, but they don't change anything in the gas phase. This mainstream smoke thus affects mainly the smoker, whom we all know should stop smoking, but if he won't or she won't quit or won't quit or can't quit smoking, because we're talking about an addiction, we've got to protect them. We've got to minimize their oxidative stress by the administration of free radicals. On the other side of the cigarette, on the other end of the cigarette, we have the side stream smoke. While you're standing in line or sitting next to a colleague that's working and smoking a cigarette, while he or she are holding the cigarette, that smoke is causing damage to you. You're inhaling free radicals, you're inhaling other carcinogens that create, and now you and I know the importance of secondary smoke, the importance of treating these individuals. Next slide, please. These are studies that we effected with Dr. Owen at the Tulane University in New Orleans, in which we took keratinocytes, fetal cells, 26-year-old and 83-year-old cell lines, and we exposed them to tobacco smoke, and then with dye techniques measure their survival rate. You can see that in the middle bars there, the fact that only about 60% of cells survived the exposure to tobacco smoke in the younger cell lines, and only about 10% or so survived in the 83-year-old. And testing those 83-year-old cells, it became apparent that they were already, like our previous conversation, they were already low in glutathione, low in antioxidant capacity. This was the findings. When we, however, in the next three bars, when we however pre-treated the tobacco smoke with the complex of glutathione and selenium, you can see that the survival rate was almost normal. They almost survived 100% of the cells, because we had neutralized the free radicals that we had collected from the tobacco smoke. And indeed, it's interesting that we were able to protect the 83-year-old cells to the same level as the younger cells. The next slide is another study that we did with one of the tobacco companies. And this is important because our group at Emory University has shown the same phenomenon in preventing the flu virus. And that is, and it's the same phenomenon that in dermatology we use, because we're applying this topically. In this graph, you can see the rapid fall of cell survival toward the left as you increase the amount of free radicals from the smoke. However, if you treated the smoke with the antioxidant complex, there was no change in survival. Most of your cells survived. When we applied the antioxidants to the cell lines, then washed it off and exposed them to tobacco smoke, they all survived. There is a protection either on the surface of the cells, as we've shown for the protection against infectivity by flu virus, and in this case probably protection to the cells, not only increasing their antioxidant content, but also perhaps something that applies to absorption of the cells. Next slide, please. This is a study by Yin in which he studied the combined effects of sunlight and smoke, and what he has shown is that in affecting skin, these were independent variables. And what you and I would have predicted a priori, those who smoked the most and those who concomitantly were most exposed to sunlight had greater degrees of wrinkles as he measured it by some accepted scoring system. The other thing, though, that he did that brings back ad nauseum what I've told you is he noted that in fibroblasts taken from these patients, that those individuals whose fibroblasts contained higher contents of glutathione were far more resistant to damage either by tobacco smoke or damage by ultraviolet radiation. Conversely, those that were low in glutathione levels were more sensitive to this damage. So that's one of the basic messages that I'd like to leave with you, is the importance of protection. Next slide, please. Now, a couple more slides before I conclude. We talked about cosmetics, we talked about therapeutics. There's one very important factor, and that is these antioxidants also work as anti-inflammatories. Remember the cardinal signs and symptoms of inflammation, the four Latin words, or calor, rubor, ardor, so that the redness, the heat, the pain may be ameliorated by the use of antioxidants and inflammatory lesions. Next slide. Just to mention a couple. Acne, for instance, a marked inflammatory reaction. You all know so well. Treatment with antioxidants, both topically and by oral administration, have been shown to ameliorate the signs and symptoms of acne. It's interesting that studies in Japan have shown that the antimicrobial metronidazole works also in these patients as an antioxidant, besides as having antibacterial activity. Next slide. We've done a study with Tel Aviv University in individuals with seborrheic dermatitis using our complex plus ketoconazole compared to zinc pyrithione, and have obtained excellent results with the antioxidant complex in terms of decreasing the inflammatory reaction in these patients and helping their symptoms. Next slide, one more. We had already talked a little bit about depigmentation. So let me close by saying here's the cell. Here's a cell in my favorite organ, the pancreas. Here's the cell in your favorite organ, the skin. They're all very common in terms of free radical production and antioxidant defenses. On the aqueous side, we have the glutathione and selenium compounds that are antioxidants in their own realm, but also primarily are regenerators of the vitamin C, and together they regenerate vitamin E. And if we continue to use in our patients the best medical therapies, therapeutically and cosmetically, we can gain a longer life and a healthier lifestyle for all our patients, despite all the exposures to free radicals that they undergo. It has been a pleasure and a privilege to be with you, and I thank you very much for your attention and your invitation. Thank you very much.
We are now entertaining questions for Dr. Hirsch.
At this point in time, we know that we all need to take glutathione. I understand that there is a sublingual, oral, and injectable form. Can you give us an overview, or can you differentiate these three as far as the serum concentration and bioavailability is concerned?
Thank you. I require a little glutathione blow to get this started. Yes, the intravenous glutathione has been used. It has a half-life of 1.6 minutes. We know that in many countries like Italy and Japan, where glutathione is a drug, not a nutritional supplement per se, that glutathione is used for treatment of chronic liver diseases primarily. And in the United States, and I know in the UK, neurologists like to use the parenteral intravenous glutathione, particularly for Parkinson's disease, because they can see an immediate effect. However, our neurologist friends tell us by the time the patient goes to the to the garage to pick up their car, this effect is gone. So that they add to this armamentarium the oral administration of glutathione. Studies have, for instance, Costaglio did a study in Italy, injecting 300 milligrams of glutathione for 15 days, and then 15 days no glutathione, and did this for six months, and they evaluated its effect on cataracts. Number one, about less than half of those individuals had less cataracts at the end of the 6 months. The remainder, either they didn't change or they cataracts got worse. So one of the problems with this is when they tabulated the expense, it would have been cheaper to do cataract removal than continue on injectable therapy. Keller has shown that if you use the buccal absorption, the oral route of absorption, you get not only a more rapid rise in concentration in the bloodstream, but secondly, the concentration is much higher than if these are given by capsules and absorbed by the small intestine. And pharmacologists like to use the area under the curve, and this is much greater for the intraoral absorption. The Mayer drug company has done similar studies with their intraoral antioxidants that they give by sprays and have some similar absorption. So that although certainly there's a place for injectable glutathione, remember that the patients that we're talking about it are going to be taking it for life, much like your vitamins. If you don't take your vitamin C for 2-3 months, remember what happened to the British Navy? They all get scurvy. If you don't take your B complex, you get pellagra and very heart disease. So we're recommending that in order to maintain health and to maintain longevity, that you continue on glutathione. And obviously, when we have a more accessible and easier route to do as it is oral administration, that's got to be far preferable than if we use it therapeutically, as the Japanese and Italians do for liver disease. So I hope that answers your question.
What is the effect of glutathione on certain cancer cells? Is it true that it provides nutrition to certain cancer cells?
If you have a patient with cancer that is receiving radiation therapy or chemotherapy, what you'd like to do is the reverse. You want to deplete them of glutathione. There's no question that you need far less chemotherapeutic levels of the various chemotherapeutic agents that have been studied. If those cells are depleted of glutathione, they will more readily die, if you will, with the chemotherapy. So we certainly recommend not good medicine,